In neurological recovery, not every red flag is loud. Some of the most dangerous red flags, such as autonomic dysreflexia and secondary stroke, are not easily noticeable. So today we are going to look at these red flags, that is autonomic dysreflexia and the secondary stroke, and how you can notice them. So to begin with autonomic dysreflexia. So this usually occurs in patients with spinal cord injury above the region of thoracic vertebra 6. So T6 vertebral injury and above, they will have autonomic dysreflexia. This is usually caused by a stimuli and it is caused by irritation of a stimuli below the level of injury, commonly within the bladder, the bowel. You can have tight shoes. Also, we have things like pressure sores. So autonomic dysreflexia will present with a sudden high blood pressure spike. The blood pressure will spike highly. Then pounding headache. Pounding headache will be above the level of injury. Then heavy sweating above the injury. If you look at the regions above the level of injury, the sweating will be very heavy. Then flushing of the skin and goosebumps, and also blurred vision and anxieties. Those are some of the ways in which autonomic dysreflexia will present. Sudden high blood pressure spike. We have pounding headaches, usually above the region of injury. Heavy sweating above the level of injury. Flushing of the skin or goosebumps. Then blurred vision. So as I have said, autonomic dysreflexia is caused by a stimulus below the level of injury, commonly below the level of injury, thoracic vertebra 6 and above. So what causes it? We have full bladder, if the bladder is full, the bowel, then we have the skin irritation like in pressure sores, and also tight shoe. So to manage this, what you do is to address the sources of pain, the causes of autonomic dysreflexia. That is, if the bowel is full, you empty the bowel. If the bladder is full, you empty the urine catheter. Then also in terms of positioning, the patient should be positioned in supine lying with the head slightly raised around 30 degrees. That was on autonomic dysreflexia, a very common complication in spinal cord injury, and it is a medical emergency. So if you notice it, you should know that it's time to take action. Then we have secondary stroke. Commonly occurs in those who have had the first stroke, and usually occurs in the second week after developing the first stroke. This, we notice it using the acronym B first. B, letter B for balance. So there is a loss of balance, the ability to maintain balance and coordination. Then the eyes. For the eyes, they will have blurring of vision. Then F is for the face. They will be drooping of face, usually on one side. Then the arms, we have arm weakness, inability to lift the arms upward. Then speech, they will have speech problems. Then T is for time. If you notice all those, then you know it is time to act. So the acronym is B first. B for balance, E for the eyes, F for the face, A for the arm, S for speech. Then T is for time. Then you know it is time to act. So this is also an emergency, and it usually requires immediate attention to prevent the symptoms from worsening and also developing the second stroke. So for this, usually what the caregivers should note is that what you should have with you is a blood pressure cuff whereby you can be able to check the blood pressure usually after around 30 minutes. So if you notice an increase of around 20 to 40 millimeters of mercury in the systolic blood pressure, then this should be a warning sign. So prevention of these two medical emergencies usually through gradual load. So we usually encourage that you monitor, manage, and move. So monitoring this whereby you notice any of the symptoms. Then managing is whereby you'll be able to now manage the symptoms. Then after that, you can now proceed to physical activity. So the two medical emergencies we've looked at are autonomic dysreflexia and secondary stroke. Autonomic dysreflexia is a medical emergency that occurs in individuals who have had a spinal cord injury, usually above the level of T6 and above. This is accompanied by symptoms such as high blood pressure, pounding headaches, heavy or excessive sweating above the level of injury, flashing of the skin, and the blurring of vision. Then for the secondary stroke, we have BFAST acronym. B for balance, E for eyes, F for face, A for the arms, and then S for speech. T is for time, which means it is time to call for an emergency.